I wanted to come today and talk to you about what it means to have rheumatoid arthritis affecting the lungs like I have. There's actually a lot of different effects that the lungs can have from rheumatoid arthritis. There's numerous things like lung nodules. You're more likely to get pleurisy, you're more likely to get pneumonia, especially if you're on immune suppressant drugs, because obviously with your immune system suppressed, you're open to all the infections out there, which has been one of my biggest problems throughout this disease. I haven't spent more than 3 weeks taking any RA drugs before I've got an infection that I've got to clear with antibiotics, and you're not allowed to take the RA drugs when you're on the antibiotics. You can get fluid on the lungs, you're more likely to get blood clots on the lungs, and what's happened with me, that in my hospital visit in July, I was in for 2 weeks and I had a CT scan. Then there was scarring across all 5 lobes of the lung. Like, there's several different names that can be associated with this sort of extra artic manifestation of rheumatoid arthritis. There is, like I call it, rheumatoid arthritis interstitial lung disease. If you search up that term in Facebook, I've got a Facebook page for support for people like us. So if you have any extra articular effects of rheumatoid arthritis, in fact, you can get this same disease effect in the lungs from most connective tissue diseases, such as lupus. Very similar groupings of symptoms and problems that come along with it. Now, when I was on methotrexate back in 2014, and I went into hospital in October 2014, I had pneumonia, but they also said that I had methotrexate poisoning of the lungs, that I was severely allergic to methotrexate, and that it was scarring my lungs. And at that point, it was only one lobe in my left lung, lower left lung, and a small collapse in that area as well. Now, I believe that I should have been diagnosed back then. I believe it's always been the RA affecting my lungs, but that they've blamed it on the drugs all along. It's easier to blame it on the drugs and withdraw the drugs. But unfortunately, since I've been off the drugs, I've been off of all RA drugs since July, and my lungs have still been bad. I've still had the same amount of infections, I've had the same amount of antibiotics, and I've had the same amount of breathlessness and low oxygen levels, and I've had that without any RA drugs in my system for a long time. Now, my pulmonary doctor would like to say that it's just the RA drugs that are damaging my lungs. I think they seem to be scared of saying this is what you've got, because obviously, like, when I've looked into it, and I don't research like an idiot, I'm not stupid. I was a university student when I became disabled, so I know how to research properly. I research full studies. I've learned a hell of a lot about this disease and everything about RA in general, but I've obviously researched specifically into RA-ILD, but it can also be called, like, it seems very rare, but it's not, because it's called, there's lots of different names for it. You know, there's people with RA that have got BOOP, COP, I can't even think of all the names, but there's loads of different names for different types of lung involvement with RA. And with other connective tissue diseases. And what my research has shown has not been good. You know, the life expectancy of this disease is somewhere around the range of 3.5 years. So I think that the doctors are quite scared of saying that's exactly what is going on. So I wanted to come out today and to say hello to all my people on the Facebook page that are like me. Hello to everyone that I've spoken to on YouTube who are like me, have issues like me. Obviously some of them are much worse than me. I'm not on oxygen yet, touch wood. I'm not dead yet. They've increased my steroids So I've really gained weight again. It just doesn't help at all, does it? I can barely move as it is. But I'm in a good place mentally at the moment. I'm doing quite a lot. I'm being more determined. I'm getting care each morning. I only get half an hour a day for 5 days a week, where I have a carer come in and help me wash and dress and have my medication and stuff. I'm trying to be more determined to be more active. That I cook a dinner every day, or try to help cook a dinner every day. My kids help with cooking and that, but I try to every day get up and take part in cooking with them. And some days it's absolutely exhausting, burning pain from doing it. And then I sit down to eat, and I will freeze up. My body will just lock up and I won't be able to move. But I still do it every day. When you have like scarring in the lungs, like I've got the added complication that I'm asthmatic, so a lot of things get put down to my asthma. But I have learned over the last year or so the difference between my asthma and the feeling of the scar tissue in the lungs, because it's like I've got a dry hacking cough and I can't breathe, as in it doesn't feel like there's enough space in my lungs to breathe. Whereas with the asthma, it's more of a wheeze and it's on the out breath, whereas on the other bit is on the in breath. So I've got like this constant struggle. My asthma was never ever that bad. I'd never had really asthma attacks or anything. Not even used my inhalers all my life. And then 2 to 3 years before I got diagnosed with RA, I started having asthma attacks constantly, chest infections constantly. And I think that was the first signs that it was affecting my lungs back then. But because I was asthmatic, of course, it didn't get put into the grouping of RA when I got diagnosed with RA. And even with because of the methotrexate so dangerous and that it can damage the lungs, when I was on that, they went, right, that's because of the methotrexate. And then when I was on the Enbrel, and I went into hospital in July, they were like, oh, it's because of the Enbrel, and took me off that, which the Enbrel would have been the first time I'd had any relief from the RA at all. It should be that I feel okay without any RA drugs in me if it is the RA drugs that are affecting my lungs. But I don't. I've been really poor, just as bad. So, and I think my pulmonary doctor is conscious of that now, and my RA team are being more like, yeah, it's RA that's causing it, and we need to get you on the RA drugs to get any control over it. And then I've got back on the methotrexate, but I'm not dead yet. So you know, I'm sticking with it because I've got the rituximab infusion coming up at the end of the month. I really want to get to that. I think that will make a big difference. And then maybe I can come off the steroids and hopefully get a bit more active, mobile and able-bodied again. Even if it is just mobile around the house more, it's better than this. Like, I'm sort of stuck in bed at the moment. Even when I'm doing things, I'm doing them in bed. My bed loves me. Risk factors for developing interstitial lung disease in RA is that it's like a higher percentage of the males with RA. As we know, the ratio of RA in men to women is 1 man to every 3 women. Smoking, of course, is a risk factor. I did smoke for 25 years. Wasn't the best thing for me, obviously, but I didn't know when I was a child that it was going to end up being such a bad thing. Having RA a long time and the presence of other systemic features is a risk factor. Like heart disease is the primary extra-articular manifestation of RA, and then lung disease comes second to that. Blood tests may also be useful in patients who are positive for rheumatoid factor, and a related test called CCP anti-CCP. I'm anti-CCP positive for rheumatoid arthritis, and I'm diagnosed as rapid onset severe RA, and I think that that's a big inclination towards that it's going to affect you in the organs, because that's the thing, people don't know that it can affect the organs. People think arthritis, they think achy hands and bad knees, but they don't think of the fact that it's actually an incurable, systemic, autoimmune, progressive disease. I'll say it again: incurable, systemic, autoimmune, progressive disease. That means that you can't cure it, not with all these diets, not with all these supplements, not with all these magic cures that haven't worked. If they did work, we'd all be cured because we're in that much pain, we'd do anything for it. Incurable, systemic, which means it affects the whole body. The systems, the eye, the heart, the lungs, kidneys, liver, everything can be affected. The skin by rheumatoid arthritis, because it is not arthritis, it is the rheumatoid. That means it's systemic, it's incurable, it's progressive, it will only get worse. You cannot get better as such. Yes, you can have a remission, but in cases where it's affecting the systems, organs and stuff, it's highly unlikely that you're going to get a remission because you're fully affected. Most people that are affected in the organs are also affected in every single joint in their body at that point. It's autoimmune in nature. All of these diseases can be grouped together. They all have very similar symptoms and they have similar treatments, similar issues all the way through. It is your own body attacking you. I think instead of getting rid of the infections and cancers, it's attacking yourself, all your healthy organs. I've got several autoimmune diseases. I've got my thyroid disease. I've got 6, 7 autoimmune diseases I'm diagnosed with. And the disease, it's a disease. It's not a syndrome. It's not a set of symptoms. It's a disease making the body ill, diseased. So please understand that if you have a friend with RA, if you have family members with RA, please understand that it's a lot more than just an achy knee. Rheumatoid arthritis is a disease of the whole body. It's very important to know that. If you want support, if you have worries about this, please come and find me on Facebook, Rheumatoid Arthritis, Interstitial Lung Disease. Speak to me through my YouTube channel. I would love to hear from any of you. If you have family members and want to know more, come and join us. You know, we're quite a select little group because of it's quite a rare manifestation, but you know, anyone from any connective tissue disease or any pulmonary involvement in their autoimmune disease, I want to hear from you. I want us all to gather together and know that we've all got each other, because it's hard knowing this. I mean, it really is, and I want to reach out and grab you all and say hi. I love you. See you soon. Au revoir. Breathe easy, folks.